I want us to begin this conversation today as we look into maternal health and and um, and healthy breastfeeding. Let me introduce, as you can see on the screen, we are going to start off with a national overview provided by the Reverend Dr. Q English, Director of the Center for Faith-Based and Neighborhood Partnerships with the U.S. Department of Health and Human Services. Reverend Dr. Q English, welcome. And the platform is yours.
Thank you, Charmaine, and all those responsible for organizing this conversation day. It's good to be back in the Bronx, albeit virtually. Born and raised in Spanish Harlem, New York, and did extensive work in the Bronx, and worked with probably many of you on the line today in combating human trafficking and domestic violence, and in criminal justice reform, and mentoring our children that were in juvenile detentions and centers, and court involved. And so it's really good to be back in this space, being able to serve and as an appointee of President Biden, and being able to direct the Center for Faith-Based and Neighborhood Partnerships. And it's a federal office located in the Office of the Secretary at the U.S. Department of Health and Human Services under the Honorable Javier Becerra. And the primary efforts of our center focus is on strengthening the response of faith and community-based organizations to critical health and human service issues, from the opioid crisis to maternal health, especially the maternal health and well-being of Black women. Nationally, there are 55.3 Black maternal deaths per 100,000 U.S. live births. And the key findings from the CDC shows that this rate is 3 to 4 times the rate of non-Hispanic white women. The U.S., we have the highest maternal mortality rate than any developed nation in the world. And according to the CDC, 80% of all pregnancy-related deaths are preventable. So maternal mortality and maternal morbidity remain a major public health concern in the United States. People with chronic conditions such as heart disease and obesity or high blood pressure, of course, are at greater risk of dying of pregnancy-related complications. And an alarming, I think, maternal mental health finding is that suicide continues to be the leading cause of direct maternal deaths postpartum, between 6 weeks and 12 months after birth, accounting for a staggering 39% of deaths in this period. And 37% of the women who died were known to have a previous or existing mental health condition. So there's much work to be done, and I'm glad to see Bronx Reach Coalition addressing this issue today. And although maternal mortality in New York City has declined overall since 2001, the maternal mortality crisis especially is still severe for Black New Yorkers. And according to surveillance of the New York City Health Department, the pregnancy-related mortality ratio for Black women in New York City is more than 9 times that for white women. And there has been an alarming increase in our Haitian community as well, particularly in Brooklyn. So the Partnership Center's efforts to address this critical public health crisis is grounded in the White House blueprint for addressing the maternal health crisis, which imagines a future where every person in the United States can have a safe, dignified pregnancy and birth, where equitable access to health care before, during, and after pregnancy is a right and not a privilege. And our work at the Partnership Center is to make sure faith and community groups are aware of the resources and programs that improve and strengthen health outcomes. And first, hot off the press, we at the Partnership Center produce a national Faith in Action on maternal health. An emphasis of the Maternal Health Guide is not only to educate, but to guide congregations on how they can actively participate in maternal and infant health. You can encourage them to build community capacity to support pregnant women and new mothers, It's going to take a village comprised of obstetricians and doctors and midwives and doulas, faith communities, nonprofit and for-profit sectors, and families playing their role in supporting pregnant women. We also encourage you to invite your team, to speak to their community and strengthen the maternal health literacy of the congregations through local experts. We also moving to really encourage community and congregation members to become doulas. Doulas are non-clinical birth workers. Again, we're talking about how do we move the needle in improving our maternal health outcomes. So these doulas are non-clinical birth workers trained to provide continuous physical, emotional, and informational support to women in their prenatal, birth, and postpartum periods. And unlike licensed midwives, doulas, they don't provide clinical support, but instead they serve as guides and advocates and emotional support for mothers as they navigate the maternal health system. It's the perfect role for community members. And if you think about it, our houses of worship are the first, are filled with women with children, or that's postpartum, or women that are pregnant. So when you think about the power of houses of worship, being able to certify doulas within that congregation, that is powerful, because now we have a built-in support system. Case in point, one house of worship in Philadelphia certified over 40 doulas. So they not only have that support system that's available to those congregation members, but they also have a support system for their community. We also encourage create these support groups for pregnant persons. You can start a group like Sisters Friend, they did in Detroit, where members can adopt a person and coach and mentor them. And they provide support to individuals who are pregnant and to their families until their baby's first birthday. You can become a safe house for pregnant persons. Safe houses are a national network of official, virtual, and physical community embedded practices and perinatal professionals providing direct services. Also, congregations, you can host community baby showers. Community members and local partners, you can join together to host them, to supply families with free baby supplies and clothes and diapers and toys and maternal wellness resources and information on sleeping and lactation and birthing techniques. The Partnership Center last year launched the Mom's Tour, the Maternal Outcomes Matter Shower, where we actually go to the community and create a village. The village you may see as exhibitors, but we see them as a village to offer support to pregnant and postpartum women through mental health wellness, to lactation support, to healthcare coverage, to doulas and midwifery services support. And so you have this village that's there through the Mom's Tour, where hundreds of women came through those doors because we drew them in through a community baby shower. Yet once they were in, we taught them how to advocate for themselves in healthcare settings. It's okay to fire your doctor if they're not right, they're not doing right by you, because we understand the healthcare disparities that exist. We understand the racism that exists in our healthcare system. So this tour has brought together experts, has brought together OBGYNs and doulas and midwives, and all of the maternal health organizations that serve these women on the ground and serve fathers, so they are getting the support they need. So when I go back to DC, they are filled with the village look. They are surrounded with the village that can continue to provide support for them even after they give birth. And so for me, that's a powerful model. We reached over 5,000 last year. We connected over 1,700 to mental health services. We connected over 800 to doula services, and we expanded the doula workforce with over 200 African-American certified doulas. So you can also invite and include them to support fathers. Fatherhood.gov is a national resource for fathers, practitioners, programs, federal grantees, and states, and the public at large who are serving or interested in supporting strong fathers and families. Why? Because it's not I'm pregnant, it's we're pregnant. You can partner with your local healthcare providers. You can promote vaccinations, because pregnancy makes people more susceptible to influenza, severe enough to cause hospitalization. And those with COVID-19 appear to be at greater risk for complication and health risk from virus. And also, I want to leave with you the Maternal Mental Health Hotline. And we hope that you will share this with your community. It's the hotline. It's 833-943 5746, 833-943-5746. It's Help for Moms. Please share it with your community because maternal depression is a prevalent problem during the perinatal period when women of childbearing age are at the highest risk for their first depressive episode. Being between 10 and 12% of women in the general population experience depression during pregnancy and postpartum. Now, when we think through the breastfeeding aspect, what we do want you to visit our website at hss.gov. We believe that breastfeeding is vitally important to the health of mothers and their infants. Breast milk contains the best nutrients to help infants grow and to protect against common childhood illnesses and infections. And research shows that allergic diseases, asthma, obesity, sudden infant death syndrome, SIDS, and some type of cancer may occur less often in mothers who have breastfed their babies. And other health benefits include breastfeeding, according to the Office of the Surgeon General, include breastfeeding protects babies from infections and illnesses that include diarrhea, ear infections, and pneumonia. Breastfed babies are less likely to develop asthma. Children who are breastfed for 6 months are less likely to become obese. Breastfeeding also reduces the risk of sudden infant death syndrome. And mothers who breastfeed have a decreased risk of breast and ovarian cancers. And most mothers want to breastfeed, but stop early due to a lack of support. And more than 2/3 of breastfeeding mothers have already begun using formula by the time their infants are 3 months old. And by 6 months old, more than half of mothers have given up on breastfeeding. And mothers who breastfeed 1-year-olds or toddlers are at a rarity in our society. And so what can community leaders do? But when we think about these obstacles, a lot of our mothers have a lack of experience or understanding among family members of how best to support mothers and babies. And there's not enough opportunities to communicate with other breastfeeding mothers. And there's a lack of up-to-date instruction and information from healthcare professionals and hospital practices that make it hard to get started with successful breastfeeding. Lastly, there's a lack of accommodations to breastfeed or express milk at the workplace. So what can we do? We need to really think through strengthening programs that provide mother-to-mother support and peer counseling. We need to use community organizations to promote and support breastfeeding. And as it relates to our families and friends of mothers, we need to give mothers the support and encouragement they need to breastfeed and take advantage of programs to educate fathers and grandmothers about breastfeeding. And right before I close, I just want to make one more point, particularly as it relates, and I overlooked this point, as it relates to maternal mental health. And this is very important to know that suicide continues to be the leading cause of death in the postpartum period, accounting for 39%. And so when we think about what more needs to be done, we need to pay greater attention to the mental well-being of mothers before and after pregnancy. So the Partnership Center, we just look forward to continue to work with Bronx Health Coalition as we address this atrocity until the U.S. becomes one of the safest places for women to give birth. Thank you.